My name is Bea Bakshi. I'm a GP registrar in North West London.
How important do you think this dispute is around the junior doctor's contract for the future of general practice?
Very, very important. What we're seeing right now is general practice suffering because of how stretched their services are. We're seeing the same changes that the government are trying to make to the junior doctor's contract is stretch services across 7 days of the NHS without the resources, without the funding and without actually doctors on the ground to deliver that service. Ultimately that's going to affect patient safety, and that's the biggest concern here, is that how can we deliver a safe service without it being resourced adequately.
Jeremy Hunt said on Sunday the BMA has been irresponsible and responsible for low morale by spreading misinformation. What's your response to that?
I think it's really, really disappointing that the government is putting politics before reason. We are not a barrier to providing a 7-day NHS, and actually we are 100 behind supporting a 7-day NHS. What the government fails to appreciate actually is the effect on patient safety in delivering a 7-day NHS. What he fails to recognise actually is that 98% of junior doctors who voted knowing what the government's proposition were, what the contract changes were, and made an informed decision about how they felt that this contract would negatively and dangerously affect patient care.
Is there a sense, speaking to GP trainees and other junior doctors around at the moment, people talk about this strike in terms of defending the NHS, defending patients. Is there a sense that this dispute has become something bigger than the detail of the contract? Is this become politicised on both sides? Is this about the future of the NHS?
So no junior doctor ever wanted to strike, and it's actually with a very heavy heart they feel that they've been forced to take this action, and it's simply because the government isn't listening to our concerns. We are seriously worried that the way that the government is going to try to impose this contract will damage patient care, be dangerous for patients and dangerous for doctors and dangerous for the future of the NHS. And for us, taking 1 day of action to defend what principles we believe in, we feel can help safeguard and protect that future.
Do you feel, as junior doctors, GP trainees, do you feel a big responsibility for the future of your profession and the kind of health service going into this strike tomorrow?
I think definitely. I think all junior doctors went into this vocation to help patients ultimately, and we did it in a way that we wanted to provide safe care and quality care to our patients. Right now we have 600 posts, trainee posts for GPs, underfilled. 1 in 2 junior doctors aren't applying for specialty training. That's seriously concerning when we're in the middle of a workforce crisis and junior doctors have low morale, are being pushed out of this system by the government forcing this unsafe contract onto us. It's really concerning actually that we now need to be more forceful in a way to communicate with the government, to say actually what you're doing is wrong, and what we need to do is listen to frontline doctors about how we can provide a safe service for our patients.
Thinking about that contract and the kind of proposals that are on the table from government right now, how would those proposals, if implemented, affect future GP trainees?
So the way that the government has tried to push this contract onto us is by to increase the number of services we do, despite knowing that junior doctors already work 24 hours a day, 7 days a week. So by doing so, you're giving us even more responsibility in addition to the responsibilities we have, without adequately resourcing more doctors, more staff or more diagnostics available on the weekend. So simply put, it's just not a safe service, which will affect GP trainees, hospital trainees and actually the whole profession.
You were at LMC's conference a couple of weekends ago and you saw the vote there. I think you spoke in the debate around unsigned resignations. If that's something that goes ahead by GPs, and you're a GP at that time, is that something you'd support?
So I work in a practice at the moment where I see all my senior colleagues, my trainers, work way beyond the hours that are safe working hours. They're at breaking point. It's clear that the service they're providing is becoming compromised by the lack of funding, the lack of resources. And we continue to hear the fact that 90% of the care we provide in the NHS is in the community, yet for only 8% of the budget. This has been going on now for many years, and actually, if not when now, when do we stand, when do we actually say to the government, you are putting patients at risk and it's dangerous, and if we do not take a stand now, we are compromising the future of our patients and the future of our profession.
So you think it is time for GPs to stand up and take action as well? I
think we have tried to make the government listen, and we are pushed and pushed and pushed. And what we're seeing now is the health of actual doctors being deteriorated, doctors being pushed to take early retirement because the workload is so overwhelming and unmanageable. We need to get the workload to be addressed, adequately resourced. We need patients' safety and patient care to be prioritised by this government in order to provide a service that's safe across the number of days that the government wants us to be working. If that means that GPs have to be put into a position where they need to stand up for themselves, I would fully support that.
So strike tomorrow. Do you think junior doctors can win this dispute?
I think junior doctors are here to actually just find a contract which is safe for the patients and delivers high quality care. I don't think this is about winning or losing, and for us it's not a political argument or a political gain here. We genuinely and sincerely just want a contract at the end of the day that doesn't put our patients at risk.
Okay, but do you think you're going to be able to get that? Do you think the government are going to compromise on this?
We don't know, and it's sad to say that we're going to be seeing significant impact on our junior doctor workforce, and many junior doctors actually leaving the country should this contract be imposed.